we're going to move to tending your garden, or let's call it the terrain. And one of you said you've been studying anti-cancer lifestyle information. That anti-cancer living idea was started by Dr. David Servin Schreiber, who actually came to one of our retreats in the early years, and he wrote a book called Anti-Cancer. And he talks about terrain in there. Terrain is a term that they use in Europe all the time to designate your body, basically this garden of what takes place in the body. So it's your internal landscape and its influence on a person's health. And there are lots of things that shape that landscape, like your lifestyle, your own metabolism, what stress is going on, what you take in from the environment. All of that can influence this terrain. And here you see a definition of it. Another term that's used a lot by people like Keith Block, who's a father of integrative oncology, and Dr. Lise Alschuler, who's a naturopathic oncologist. But you're going to hear these folks who work more in integrative cancer care talk about the tumor microenvironment. And this is the little microcosm of environment that surrounds a cancer, a tumor cell, and it's your normal cells, its molecules, its blood vessel. And the tumor can change this microenvironment so that it works to its advantage. So it can start to create blood vessels that come to it, bring its own nourishment. It loves inflammation. So if there's inflammation going on around it, it will sort of co-opt that for its own purposes. So there's a little microenvironment around the tumor, and some of these practices are working on making that little environment around the tumor inhospitable to the cancer. So I'm not asking you to be master gardeners, but it's important to understand a few gardening concepts in order to understand how lifestyle practices can help create a body that cancer cannot thrive or survive in. So for now, let's compare the cancer to the seed and one's body as the soil that cancer might try to use as a growth medium. So your terrain is the body that surrounds it. Conventional cancer treatments tend to be focused on killing the cancer seed or the cancer cell, which we treat it like it's a weed or a pest. Kill it and we can go home to supper, right? Well, not quite so easy. How many of you garden? How many of you have seen that the pesticide or a weed killer you used didn't work because you misidentified the pest or the weed, and you used the wrong poison, or you used a poison that the pest or weed became resistant to? So a few years ago, I learned from my sister, a real master gardener, that if the soil is healthy, there's actually less need to use lots of pesticides or fertilizers, because the soil's healthy microorganisms and the biochemical balance favors the growth of the vegetables and the fruits. And the vegetables and the fruits are stronger, they're more resilient to the pests, and they don't need that much help from these chemicals. Well, our body's relationship with cancer is not that different. No matter how powerful our treatments are at killing the cancer, the seed, they won't succeed as long as the body provides the food and the fodder for cancer to do what it does best, which is grow and circumvent programmed cell death. So normal cells know that at some point they're not useful anymore and they die, but cancer cells find a way around that. So as the founder of integrative oncology, Dr. Keith Block says, even if the original tumor is gone, this biological imbalance creates an environment for cancer to recur Tumor cells use the body's healthy resources to grow and multiply. Any one of the 7 healing practices can have an effect on a person's terrain and ultimately the environment that surrounds the tumor. So I'm going to show you, I have a bunch of books here. If you want to hear more from Keith Block, here's his book. Carla, can you see that I'm holding this up because I can't see myself?
Yes.
Okay, great. All right. So, is there evidence that taking care of your terrain makes a difference? Well, Dr. David Servan-Schreiber sort of sums it up well. If people who already have cancer, there's sort of this dose effect relationship between regularly using these practices that improve lifestyle and how much protection they get from the cancer. The more involved you are in changing your terrain, the greater the benefits. For example, people with breast cancer who adopted a healthier diet and regular exercise lowered their risk of relapse by nearly half. So that's pretty impressive. So there's evidence that it might be a good idea to modify your terrain. So let's talk about how we do that. Your doctor might throw the most powerful surgery and radiation and drugs at the cancer. And even though these therapies might effectively kill most of the cancer cells, believe it or not, they weren't really designed to kill all the cancer cells and keep it from returning. We're relying on our body to do the rest of the work. So the goal of the treatment is to get the cancer cell count down as low as we can so that your body's defenses can now take over and your body's health can now become inhospitable to cancer. So what we have to do is meet the conventional cancer treatment in the middle, letting healthy lifestyle practices carry the baton from there. And what we know about a healthy lifestyle is that it can reduce the symptoms of cancer and the treatments. And now think of that. If you reduce the symptoms and side effects of cancer treatment, what we know is that the person will more likely be able to take the full dose of the treatment for the full length of time. And that has something to do with outcomes. So if we can manage those symptoms well, then it ultimately can affect your outcome. It increases your resilience to the side effects of conventional treatment, as I said, improves quality of life, reduces inflammation, which is one of the factors that definitely drives cancer. Cancer loves inflammation. It gives it all these chemicals that it can use for its own advantage. It reduces the risk of other illnesses like heart disease, diabetes. Sometimes it reduces the risk of recurrence or slows the progression of illness. And ultimately, it creates a body terrain that's inhospitable to cancer.